Welcome back to my channel. In this video, we will be discussing about the sternocleidomastoid muscle. Now try to move your head towards another side and see that there is one muscle near your neck region which helps you to flex your neck in the opposite direction. That is the sternocleidomastoid muscle, as you can see in this person, right? So this is the sternocleidomastoid muscle we will be discussing about in the whole lecture. Now sternocleidomastoid muscle is a muscle of neck. So it is one of the sternocleidomastoid muscle and trapezius muscle are one of the muscles of neck. All right, first point. Then second, both are supplied by spinal root of accessory nerve. I will guide you through, so no need to think that you do not know something. Now for the first heading that is always used in anatomy is origin. Now sternocleidomastoid muscle has two origins. All right, first is the sternal and second is the clavicular. All right, it has basically two heads. Now as you know from the name sternal, it means the chest bone, right? So see, this is the manubrae sterni. This is our sternal head. So it is one head is arising from the manubrae sterni. So sternal is manubrae sterni, and the clavicular head is from the medial half of the superior surface of clavicle. Now what do you mean by this? See, we saw that this is the sternal head, this is the clavicular head. So this is the clavicle, and what I told you is medial half of this superior surface of the clavicle. All right, so these are the two origins. Now insertion is also at two places. One is mastoid process and second is the lateral half or 2/3 of superior knuckle line on occipital bone. Now what do you mean by this? Now mastoid process is behind ear. All right, so suppose this is something like your ear over here, and this is the mastoid process. So what you see is that it is being attached to the mastoid process, and then this is the occipital line and it is attached over here. So two insertion. All right, so this is the insertion. Now I will tell you what are the knuckle lines. Now this you need to know. See, I have a skull. I will first help you through one easy diagram. See, this is the skull we have. All right, now what you see is this is the occipital bone, suppose. So this is the most uppermost one. So this is the high knuckle line. This is superior knuckle line, and this is the inferior knuckle line based on the position. Now what you see over here, this part is what is called as external occipital protuberance. External occipital protuberance. And what you see down here between at the middle of the inferior knuckle line is external occipital crest. All right, so even if you forget, just remember PC. So P will come upper and C is down. All right, now what did I tell you is that the sternocleidomastoid is attached to the lateral 1/2 or the 2/3. So somewhat like this. All right, now this is like from this you can see, and this is like gross. So what you see is this is our occipital bone, right? And one line is here, if you can demarcate, right? This one, and then there is another, and then there is another. I told you P comes first, so protuberance is in the superior knuckle line, and then crest is in the inferior knuckle line. All right, so this is also same. In this, what you can see is this is highest, then this is superior, then we have third pay inferior knuckle line, and this is our occipital crest. All right, then they are also showing occipital protuberance, which is this one, right? Very good. And then fifth is the medial knuckle line. This is our maxillary artery. This is facial artery. This is superficial temporal artery. All right, this is ascending pharyngeal artery. This is occipital artery, and this is post auricular artery. All right, so I told you superior thyroid artery, all right, and occipital artery. Then in suprascapular, I told you that it is the branch of thyrocervical trunk. Now thyrocervical trunk has 3 branches. Remember it by SIT. So by S you have suprascapular, by AI you have inferior thyroid artery, by T cervical artery. Now coming on to the actions. In actions you have 2 headings. One is when both contract and when one contract. When one contract you can turn head to opposite side, and when one then you can tilt the head and shoulder to same side. Then when both contract you can flex the neck along with longissimus coli muscle. Remember the name of the muscle. All right, and you can it helps in forceful. Now why are we studying it is like applied anatomy. So there is a condition called as torticollis or wry neck. Now what happens is in torticollis either it is congenital or it is rheumatoid. In rheumatoid it is because of cold. Congenital is because of compression of veins or something. All right, torticollis. Then there is reflex torticollis. In reflex what happens is there are swollen nodes which impinge spinal root of accessory nerve, so they bar the function, so leads to torticollis. All right, now let's just go through it through the book. So